Greetings and welcome to my Intro to Public Health 101, a free study course for all of you MPH students. I'm Deidre Sully. I'm a public health professional with almost 20 years in the field. I've done research, tobacco control, policy, and advocacy, and I think it's important to at least pay it forward or reach back behind to those who are coming along, right? So, that being said, I'm sharing my knowledge and experiences with fledgling MPH students in mind. Also, for those of you who are just interested in public health, as always, this course can be used for a study guide or even practicum ideas. The first lesson will just be about an introduction to what public health even is, and then we'll go over a brief history and timeline. So, why don't we get into it? So, in today's lesson, our learning objectives are 1, an introduction to concepts and characteristics of public health, and 2, a review of the history of public health. In this lesson, we will go over introduction, and that includes public health terms for the lesson. So there are several terms that you should pay attention to throughout this lesson and during each individual module or lesson throughout the course. We're going to highlight several which will be defined as we move through the course and the classes. You'll have access to a glossary of terms in this lesson on my website, www.deidresully.com. We'll also go over what is public health. So we'll clear out some definitions and things like that. And then we'll also go over history and timeline. We'll then go over a knowledge check. We'll see how much you can recall. Just a few quick questions. There will be more on my website where you can take a self-paced quiz. So some terminology and concepts that you should be aware of and look out for this during this lesson: community health, population health, intervention, prevention, endemic, epidemic, and pandemic. Those last three are really, really important as they're very relevant to what's happening in the world today. So what is public health? There are official definitions, but I was taught and instructed on the importance of breaking down and really digging into the etymology of words and phrases. So first, let's break down the phrase to basic words, public and health. Now, of course, we all know that public means of the people. And if you don't know, now you know. Pretty easy, right? It's defining health that gets tricky because there's no one size fits all when it comes to deciding on the health of an individual. So what is health? Well, it is officially defined as a state of being free from illness or injury. In truth, it's a dynamic and complex concept that's not merely the absence of disease. It encompasses several dimensions of well-being: physical, spiritual, cultural, emotional, environmental, and many, many more. So, based on the individual word and definition, at the very basic level, public health concerns the complete state of well-being of the people. We do have some officially accepted definitions by national and global organizations. So the official World Health Organization, or WHO, definition of public health is organized measures, whether public or private, to prevent disease, promote health, prolong life among the population as a whole. So keep in mind those 3 P words. We'll get into that later. The CDC designates the public health, the definition of public health as the science of protecting and improving the health of the people and their communities. All of these are very true and very important and things that you should keep in mind. So since that's not on the slide for the CDC, I'll repeat it. So the CDC's public health definition is the science of protecting and improving the health of people and their communities. So some things that I want to make sure that we get into. So here are the first 2 terms: community health and population health. That kind of came up in those 2 definitions, right? So let's give the the definition of community health, because there are two concepts that sit inside of public health. They are not separate. They're definitely interconnected and woven into one another and related. So community health it aims to identify and address unmet health and social service needs within a geographic area and helps residents overcome barriers to access. So this is kind of like a grassroots movement. We're going to address health issues at the community level where people live based on their geographic location. So an example could be a community health center that addresses the needs, disease, or even barriers to access of people who live in a certain neighborhood. So the next one is population health. And population health is an approach that focuses on outcomes with a group of people rather than the individual. It factors in broader issues that surpass geography. So you can, populations actually can sit inside of communities, or they can be, as the definition said, broader than a geographical area. So that means women or children or seniors or men's health. So those are specific populations or examples of specific populations. So an intervention could be addressing maternal mortality and morbidity rates among women of color. We know that population has very high mortality and morbidity rates because of issues with racism, lack of access, lack of knowledge, and many more issues and many more reasons. Also, as we know, the issue of not believing them when they say that they're in pain. So a lot of these are issues of diversity, equity, and inclusion, not being exposed to different kinds of people, and also having very biased and things that implicit bias and also explicit bias that perpetuate amongst people because they're never educated on what has to happen for a particular population. So this is why population health is very important with regards to public health. So when we put it all together, the population health, the community health, and the public health. Public health is, where we add in, yes, it's that preventing, prolonging, promoting. It also adds in that element of policy and legislation, many times backed by funding, filtered to local health departments, nonprofits, community-based orgs, and health institutions. So let's move on to the very widely accepted and one of the first definitions of public health. And that's by CEA Winslow. And it reads, "It is the art and science of preventing disease, prolonging life, and promoting health through organized efforts of society." So what does that mean? Well, first, CEA Winslow was a Yale professor who is widely accepted as a pioneer of what we know as public health today, after launching the Yale School of Public Health in the 1920s. And interestingly enough, he was a bacteriologist. So he was way ahead of his game, or way ahead of the game, when he coined this definition. So let's break down, as we did in the beginning, what does that mean? Let's break down the definition or this concept in this phrase of public health. So why art? Let's start with that. Art is usually an expression of creativity. It is the expression or application of human creative skill and imagination, typically in a visual form, such as a painting or a sculpture. It's producing works to be appreciated primarily for their beauty or emotional power. So how does that relate to public health? Well, in this vein, management, coordination, and facilitation of people, that's an art, that's a skill. It's an expression of application of human creative skill. Sometimes you got to get imaginative when you have to corral people into a certain ideology or way of thinking, when it comes to health promotion and prevention and the like, right? So that idea of coordination, facilitation of people in or teams or programs and systems, it becomes an art form, managing all the players. So how is it related to a science? Well, what is science? It's systematically organized body of knowledge on a particular subject. So, for example, we'll get into this a little later in lesson number 2, but I'll give you a teaser as an example for science. There are 5 core knowledge areas and 10 essential services in public health. These are all developed interventions and learning, which then becomes an evidence based body of knowledge, right? So when we go back, it's a systematically organized body of knowledge. So when we have collected via research and empirical data, like lived experiences, these are all, and then we corral them and we put them all in journals, we put them all peer-reviewed journals, of course. We put them on paper, we put them into practice, whether it be via intervention or prevention. That is when we have outcomes, we collect that body of knowledge. It becomes part of our body of knowledge, whether it is the right course of action or whether it's the wrong course of action. We'll find out through collecting that data and through the outcomes that come about, right? So systematically organized body of knowledge on a particular subject. So you can think of it as those 5 core knowledge areas, which we'll get into later, of public health. So, and the last part of this that I wanted to point out are organized efforts of society. What are organized efforts? Well, organized efforts indicates involvement of governing bodies, agencies, private organizations, healthcare providers, and community or populations. It can also mean government, right? Everybody's a player, everybody's a stakeholder. The main point is this is where government gets involved many times when it comes to funding, developing regulations and rules and policies, and filtering them down through the masses. And it can be any level of government, whether it's federal, state, or municipal, or even at the county and local level. So it can be very, very specific to what a community or population within a community needs. So the second part of this that I wanted to dig into or tear apart, and kind of like highlight for you are the 3 P's within this definition. And I like to call them the tenets of public health. And you can look more into what I call the tenets of public health in my book, which you can find on my website, www.deidresully.com. It's a free download, the 10 points of public health. And we dig into these 3 tenets or 3 P's, which are preventing disease. So what is preventing? It's stopping something from happening. In health, prevention must be proactive. But in many cases, we have seen that it's response-based or reactive, right? As we'll get into the history and timelines, we see that when there were different plagues and pandemics, the response was reactive because there wasn't necessarily a knowledge of what to do. But then when you have inoculations and vaccines, there is it starts out as reactive, but then becomes a very proactive response for prevention and preventing the actual preventing people from actually contracting certain diseases, right? So the next one is prolonging life. So what is prolonging? It's extending the duration of our time here on this plane or past the average lifespan. How do we do this? By altering behaviors as brought on by the other 2 P's. When we go through preventative measures, it alters the way that we react to things or the way that we address things as they come up. And also through promotion as we're more aware and educated of different behaviors that we can take on. So that goes to the next one, promoting health. Promotion. It's a highly effective tool to raise awareness among the masses, whether it's done by communication practices, which is campaigns, or creating spaces that force or encourage behaviors. So what is an example of creating spaces that may enforce or encourage certain behaviors? Active design, another thing that you can read more into in my ebook. So when we think about active design and places that are made to encourage people to be more physical in a certain space, because physical activity, it leads to physical fitness and can help overall with health. So that's an example of health promotion as far as like encouraging in space, being encouraged in spaces. But also, as I mentioned, there's health campaigns. So I'm sure depending on what generation you are, there's, just say no, right? And so that was a very, we'll say, a vintage public health campaign promotion when it comes to substance abuse. And so these are different ways that we can, have communication practices within health promotion. So Winslow was pretty comprehensive in his definition, and especially for it being the 1920s. So it was pretty insightful, right? However, it doesn't mean that other institutions of higher learning didn't have public health programs, and there were public health systems in place by this time. And that's because there had been reactions and responses, right, to things that were experienced when it comes to health and healthcare over time since ancient history. So let's look at the history. So we'll go over this history and timeline and of public health, and through beginning with the first laws and codes in ancient history to the fall of empires and therefore health codes and reactive public health measures that came as a result. Then to more the era of enlightenment and things that happened there, onto modern and current day public health actions. So when it comes to public health, the history of public health, well, the first existence of public health existed with laws and codes enacted by ancient rulers, which were believed to be passed to them by their respective deities. The first one that we can call on is the Code of Hammurabi. So out of the 200 plus laws, there are 4 that speak to the health and the practice of medicine. This code included regulation of physician fees with punishment for treatment and failure. It is the first semblance of a public health care system. The Code of Hammurabi is around 1700 BCE, so before Common Era or before Christ. This is how old the Code of Hammurabi was, and it's out of Babylon. So this is a Babylonian culture that brings us the Code of Hammurabi. And almost about 200 years before the laws of Leviticus, which are also actually considered to be the first health systems by some. And you may know the laws of Leviticus from religious texts or scripture, such as the Holy Bible. The book of Leviticus is actually the book that lists out the laws of Leviticus, pretty much the entire book. So it's while it's considered the first public health care system by some, it actually goes over what should be eaten, how it should be eaten, what should not be eaten, hygienic practices, what is clean versus unclean. And it's interesting to know that these first parts of history are ancient laws and codes. So we're already getting the instruction, or people who lived then are already getting instruction on how to comport themselves and conduct themselves when it comes to health and the health of those around you and your community. Other areas when it comes to ancient laws and codes or ancient activities in public health are like aqueducts of ancient Greece and Rome, bringing water into the city and also pushing out sewage. There were definitely cultures that had, and Babylon as well, with sewage systems. The problem is, while it helps with sanitation within the city, it would contaminate water sources and therefore become polluted. So when all that sewage was moved outside of the cities or the populous areas where people live, water sources, fresh water sources, were being contaminated in many instances. There was also the introduction of ancient public hospitals. So the idea of a hospital or a place where it's communal care is not brand new, or it's not from modern era. There definitely were public hospitals. Hygeia, the cult of Hygeia, around 430 BCE in Greece. So these were a group of individuals who really focused on this deity, who was the deity of hygiene and sanitation and cleanliness. So cleanliness is next to godliness. This is not a new concept, right? There's also things like the laws of Manu. the Manusmriti, which is a Sanskrit work by Brahmins. It's one of the foremost Hindi works. It's debated to have been written anywhere between 1500 BCE to 200 CE, widely considered to be an ancient work that outlines the caste system that is actually currently in practice today in that area of the country. Like its Near East or Middle East predecessors, like the Code of Hammurabi and Laws of Leviticus, it also codifies hygiene and sanitation. Other ancient codes like the Ebers Papyrus and the Kahun Papyrus, while they carry the name of European translators, they are definitely Kemetic in origin, or what some call Egyptian, and they heavily influence Greco-Roman health practices and codes. So these are all ancient laws and codes that have been in existence way before our Age of Enlightenment and modern era. So it's interesting how when we move into medieval, how there's this descent of plagues and pandemics. So it makes you wonder, like, so had the laws continued to be followed, would we have the same history when it comes to illness and death? So in the medieval era, so about 500 CE to 1500 CE, we have plague pandemics. So the first one, and this is not necessarily the first plague, but because there are three known plagues, the most popular being the bubonic plague or the Black Death or the Black Plague, it became like three pandemic. It emerged during three pandemic timelines as a pandemic during three timelines. So here's our next word. Pandemic. Let's make sure we understand the word pandemic. It's Greek in origin and formed from two words, pan, meaning all, and demos, meaning the people. So a pandemic is an outbreak of disease that occurs over a wide geographic area, such as multiple countries or continents, and typically affects a significant proportion of the population. So it knows no boundaries and crosses borders. Additionally, a pandemic is quite distinct from an epidemic. So there's another word. Make sure you take that down. Although similar, an epidemic stays within a smaller geographic area, and it can be used interchangeably sometimes with outbreak, and refers to a relatively quick spread of a disease, also to large numbers, but doesn't necessarily cross as many borders as a pandemic, as we have seen even in more recent history with COVID-19, which is a SARS virus. So the Black Plague or bubonic plague or Black Death, as I said, became three pandemics at three different points in time. So the first one, the first plague pandemic, as it's called, was the plague of Justinian, right? And it was a 6th century Roman emperor who ruled Rome at the time between 527 to 565 CE. The first cases were in Roman provinces in the east and in the Far East meaning Asia and Egypt, around 541, at least a year before appearing in the Roman Empire capital of Constantinople, which is modern day Istanbul, Turkey, which in 542 CE. So the other thing about the Black Plague, it's very important to know that it was caused by Yersinia pestis. That is the Latin name of the disease. And it's a bacterium, here's the next word, which is endemic to rats, and it was spread by rat fleas, specifically the black rat. And endemic, what is endemic? It is natural to, prevalent within, and confined to a particular area, or in this case, a particular species. The origins of both the black and brown rats have been traced back to Asia. So while it didn't appear in Rome until 542, and it also appeared in Egypt a year before that, most likely it came from trade, maritime trade, and land trade as well, in countries interacting with one another. So again, remember, it crosses borders. In this case, it crossed the ocean. So rats were hiding out on merchant ships and trade ships, right? So the outbreak actually raged through the Mediterranean basin. And while the first documented case that we know of, like, it was in Egypt, Pelusium, which is a city in the Nile River Delta, it is believed to have its origin in Asia and spread by the trading ships. And as I said, the the black and brown rats had their origins in that region of the globe. The second plague pandemic. So this is the one that people think of the most when they think of plagues, which was the Black Death. This literally wiped out a third of the population of Europe. So it's named for the buboes that form on the skin, boils filled with pus. So it's the bubonic plague. And though recent research has indicated that the pathogen responsible for the Black Death may have existed in Europe as early as 3000 BC, what we know of now is how the Yersinia pestis bacterium spreads. So there are different studies and different information that comes that people are looking at that says like, well, ask the question like, where did this truly come from? Was it existing? And it doesn't mean that it didn't exist. What we really go by is when things were first recorded, right? So it doesn't mean that the plague, because we do know, for those of you who read scripture, plagues were prevalent and plagues existed in ancient history. Plagues existed during the time of the Kemetic pharaohs and Hebrews, in Exodus from Egypt. So these are not the first plagues, but these are the first ones that have been recorded with specific attention to what we call the Black Death or the bubonic plague. And it has made its appearance over time. So as I said, there's 3 plague pandemics when it comes to the Black Plague. The first one being the plague of Justinian. The second one is what we call the Black Death, the same bacterium, Yersinia pestis. And then between and during the 1600s, there were many advances in science that addressed the plague, again, reactive or responsive. And sometimes that's what has to happen. But the third plague pandemic actually made its appearance closer to in the 19th century in Asia, in India. So it's not totally a dead disease. It's still around, but it's not as prevalent as it was during those times. And again, this is because of advances in medicine. So in the 1600s, there were many advances in science that were response-driven, and as a result of outbreaks due to growing populations, lack of sanitation. For example, collection and study of vital statistics became popular. Observing bacteriology with the invention of the microscope, germ theory. However, these successes brought on evolution to more proactive measures. And that brings us to our more modern times, so 18th century to 20th century. Biological warfare was a thing. When we think about the smallpox blankets in 1763 that were distributed to indigenous people in the what is now currently the United States. And while certain groups have debated whether this is true or not, biological warfare is definitely a public health concern because it is how diseases can be spread to a large amount of the population. Just like plagues and pandemics, or even epidemics, it's a large amount of people who are affected who will either get sick or die. Then we have the invention of the Public Health Service in 1798, the invention of the Public Health Service. It was initially the Marine Hospital Services, which was set up to address diseases seen in sailors and trade ships, or diseases that are considered maritime diseases like scurvy. And then it evolved to an organization, an agency that actually creates laws and rules and regulations to address other public health issues. So as you can see, it moved just from dealing with maritime diseases to things that were more broad, that affected more people than just sailors, right? So if we go back to the idea of populations, like sailors were a population, and then they expanded it. In the 1800s, microbiology, leading to pasteurization by Louis Pasteur, vaccines and immunizations for the bubonic plague, tuberculosis or TB, and cholera were definitely advances that were made. And then in 1872, the American Public Health Association was formed, right? Then in the 1900s, which is the 20th century, we saw the creation of the FDA in 1906 and the Environmental Protection Agency in 1970. Um, in the 1940s, 50s, and 60s, we see water fluoridation to address dental public health. And we also see the polio vaccine. So, with water fluoridation, it actually began in some parts of the United States in around 1945, after scientists noted that there were some areas that had naturally occurring fluoride in the water. And in those areas, those residents in those areas had fewer cavities. So, starting in 1960s, around 1962, the United States Public Health Service, right, that was started in 1798, they recommended that public water start including fluoride. So, fluoride was inserted into water sources to help prevent tooth decay. Many products, as a result, were created that also had fluoride in it to address dental health, and they contain fluoride. However, some of the issues there is that earlier studies didn't take that into account, that there would be maybe an overproduction or overconsumption of fluoride as a result. So we've got fluoridated water, fluoridated mouthwash, fluoridated toothpaste. And so, in any levels, anything in excess can definitely be dangerous. Excessive fluoride can cause fluorosis, which is changes in tooth enamel, ranging from white spots that are barely noticeable to staining and pits within the teeth. So fluoride can also be dangerous. And so, even though at that point it was a response to tooth decay and dental public health, now we know more. Now we have more evidence. So we have to be a little bit more discerning in how much fluoride goes in the water and how many fluoridated products we use. And yes, the FDA, the Environmental Protection Agency, they do regulate how much fluoride should go in these products. At the same time, if you're still using an abundance of products that have fluoride in it, you probably should look at it. So, moving on from water fluoridation, in 1950s and 60s, like we're in the 40s, 50s, and 60s, we see the introduction of the polio vaccine. So polio, or poliomyelitis as the disease is called, was devastating to an entire generation, afflicting many infants and children. It was sometimes called the infant death disease, or infantile polio, right? The most famous polio person with polio was former president FDR, Franklin Delano Roosevelt, who contracted it about 30, or at 30 you could see worsening symptoms. So the first delivery of the polio vaccine was actually in Pittsburgh, and this is actually pre any approval, because remember that yes, the FDA was in 1906, but this study was actually done in 1954, and it was through funding from the March of Dimes. And they did this in Massachusetts with the Children's Hospital, inoculating a good number of children from polio, and it was successful. However, that polio vaccine was using an inactive strain, so the polio within that vaccine was dead. And the polio vaccine that actually ended up being mass produced and widely used, and the original version of what's used today, was actually came about in the 1960s. So then that's where we see, like in the 1900s, 40s, 50s, and 60s, we see water fluoridation. We see the advent of the polio vaccine as a result to devastating effects of contraction of polio by many, many children. In the 1970s, Environmental Protection Agency is born. It's following a peak of interest in environmentalism. So being aware of pesticides and chemicals that affect the environment as a result of industry. And then they're also the cause of diseases that were showing up in humans. So what's going on as we are mass producing, like agriculture? What are the pesticides that we're putting on the food? What's being and what are the things that are leaching into the water as a result of different production of different products that are also used by humans? Finally, public health systems matter a great deal, and they work to reduce the spread of disease Utilizing scientific knowledge and by evaluating and analyzing research allow for the production and data production of data and of information. Then the information is shared via health education, awareness campaigns, and even develop policy, which is regulatory and legislative. As a result, people can make informed decisions about their health. So that's a quick and dirty timeline or history of public health from ancient history to where we are today. So let's do a quick knowledge check. So health is more than the absence of, and I'll wait a little, give you a little bit of time. So if you said disease, you would be right. Health is more than the absence of disease. What are the 3 P's in CEA Winslow's definition of public health? It's also in the CDC's definition of public health. Well, I also call the 3 tenets. Preventing disease, promoting health, and prolonging life. So make sure you're writing this down. And all of the notes from this PowerPoint slide will actually be available on my website, so you can see them written down there with all of the sources. True or false? Prevention can be an intervention and vice versa. So this is a trick question because we didn't necessarily go specifically over this topic, but if you were listening, you would have realized the answer. So the answer is true. Because prevention is stopping something, the intervention definitely can be to cease an activity. What is endemic? Do we remember what endemic is? So if you said natural to, prevalent within, and confined to a particular area, you would be correct. And our last knowledge check question, what was one of the earliest public health codes? If you said the Code of Hammurabi, you would be correct. So thank you so much for joining me in this course. There will be more to come. Lesson number 2, we're going to go over principles and core services. So, and other upcoming lessons within this course are public health communications, and we'll go over the health equity framework. I can't wait to see you, and you're joining me for the next time. So here's how to find me. You can contact me at deidresully@gmail.com. My website is www.deidresully.com. Or you can also subscribe to the podcast, True Health Live. You can find me on youtube.com at True Health Live, or you can also go to deidresully.com and follow the prompts to subscribe to the podcast and download it and listen to it on any of your favorite platforms. You can also make sure that you download the free ebook, 10 Points in Public Health, Elements and Concepts, where we go over the 3 tenets in public health: prevention, promotion, and prolonging life. We also go over some other concepts when it comes to health policy, the P's of public health, and also the basics and fundamentals. You can find me on any of the social media outlets at Deidre Sully on Facebook, Instagram, and Twitter for as long as it's around. Thanks for joining me. Peace.